Hello, everyone. Good morning. Chloe, have I unmuted you?
You have. I can talk. Can you hear me?
Yes, I can hear you. Awesome. Well, welcome everybody and happy Pride Month. I hope everyone has found ways to still celebrate and enjoy this month, even in the midst of social distancing. We are right at 10 o'clock, so I'm going to give us another minute or so just to make sure that everyone who is planning on joining us this morning has time to hop on before we really jump in. I'm Megan Batista with the Tennessee Coalition to End Domestic and Sexual Violence. I'm co-presenting today along with my colleague, Chloe McMurray. So yeah, Chloe's also on the line, and we also have Kendra Miller, our lovely training coordinator. She's also here with us and will be available to help us with any technical issues we might have. Let's go ahead and make sure that everyone is able to use the question box, make sure everyone can hear us and isn't having any problems. So if you want to test out the question box, it should be on the right of your screen. Go ahead and just type a quick introduction in there. Let us know where you are tuning in from, what city or state you're in. You can add your pronouns if you'd like, your job title. Just tell us whatever you'd like us to know, and we'll make sure that we're able to view all of those. Hi, Dylan. Glad you're here too. Hey, Angie, tuning in from Cleveland. Hello there, Oriana. Thank you for being here. And Shonda from Bristol, Virginia. Awesome. Anyone else? Barbara from Morristown, Tennessee. Welcome, Barbara. Great. I think we have a pretty good turnout today. It's a few minutes now after 10, so let's go ahead and dive in. Michelle and Adriana, welcome from Gallatin. Woohoo! That's right in my backyard. Okay, great. Thank you all again. Thank you so much for being here. We're really excited about doing this webinar. You've joined the webinar titled Serving LGBTQ plus Survivors of Domestic and Sexual Violence in Rural Tennessee. We are actually going to talk about rural America though today. We will cover a few things specific to Tennessee. I think that's where most of us are from. That's where most of us work. But we hope that no matter where you are tuning in from, you'll be able to learn some new things and benefit from this webinar this morning. We'll cover some things that, that can be applied to all rural areas across the United States. So yeah, thank you again for testing out the chat box and everything. Please do let us know if you have any issues. You should be able to see my PowerPoint as well right now, but please let us know if you're having trouble viewing that too. Again, like I said, my name is Megan Batista. I use she, her pronouns. Let me get my slide here. There we go. And I'm a program specialist here at the Tennessee Coalition to End Domestic and Sexual Violence. I've been here for over 3 years and I work on the Coalition's Rural Sexual Assault Project. This is a project funded by the Office on Violence Against Women. As always, the views I express here are my own and not necessarily reflective of those of the Office on Violence Against Women. And the focus of the Rural Project is to enhance and improve services for male and LGBTQ plus sexual assault survivors across all rural Tennessee. And we do that by partnering with some amazing sexual violence service providers across the state. And we provide training and education around these topics. So it's through this Rural Sexual Assault Project that I'm able to bring you this webinar today, along with my co-presenter, Chloe McMurray, who is also to credit for this webinar. So Chloe, I'll let you go ahead and introduce yourself.
Yes, hi everybody. So like she said, I'm Chloe. I also use she, her pronouns, and I've been at the Coalition just since January, but previously I worked under the role grant that Megan is in charge of. So I have experience with that grant. I have experience working with the LGBTQ community in rural areas. I'm from a super small town in eastern Kentucky that borders Tennessee, so I'm familiar with rural Tennessee and have always worked with marginalized groups of people. And at the Coalition, I work under the VOCA TA grant. This grant allows me to travel across the state and work with partner organizations that serve underserved populations and marginalized people. I also head an inclusivity committee that's made up of various members across the state, and we network and we try to make changes of policy regarding inclusivity and marginalized people. So that's me, and I'm super excited to be here.
Awesome. Thanks, Chloe. Okay, so why are we here today? What are we going to talk about? There's a common misconception that LGBTQ plus folks only live and choose to exist in urban big city settings. I think media and pop culture is certainly improving in its representation of LGBTQ plus folks and the way that they exist in this world. But when you think about 10, 20 plus years ago and the examples that pop culture gave us of LGBTQ plus folks, we saw a lot of the small town character who's never met anyone gay until they move to the big city, or the small town gay person who escapes to the big city for an opportunity to come out and live openly. And while these narratives can certainly be true, they are not the only reality. In fact, there are many LGBTQ plus folks living and choosing to live in rural America for the same reasons that any person would choose to live in rural America. For some of those benefits and appeals that rural settings offer, it really don't have anything to do, of course, with one's sexual orientation or gender identity. So today we want to talk about those misconceptions around LGBTQ plus folks in rural settings. We also want to address that there are some reasons that LGBTQ plus folks can and do face increased discrimination and additional barriers to services in rural communities. So if you are a service provider who is new to a rural area, maybe you're someone who's been living and serving survivors in rural areas for years, or maybe you're just someone who wants to learn more about the unique experiences of LGBTQ plus rural folks, we hope we can offer you some useful knowledge and tools this morning. We're going to start with some language and important definitions. I'm going to pass this back over to Chloe.
So when you're talking about the LGBTQI plus community, it's always good to set the foundation for terminology, because Megan and I are going to be using all of these terms throughout the rest of this webinar, and we just want to make sure that we're all on the same page. And this is stuff you know, this might be stuff you don't know, but either way, this is where we're going to start, and hopefully this will clear up any misconceptions that might exist about some of these. So obviously the L is the first letter in the acronym. The L is lesbian, who is a woman who feels romantically, emotionally, and sexually attracted to other women. This is a descriptive and socially acceptable label that homosexual women often prefer because it offers an identity that's separate from that of a homosexual man. And so the G is gay, a man who feels romantic emotional, and sexual attraction to other men. The B is bisexual, and I want to clarify that bisexual does not mean attraction to both male and female genders. Primarily, that is what people think bisexual means, but and I even thought that originally, but you hear bi, you think two, and it does still stand for two, so it's two attractions in that it is an attraction to one, the same gender that the individual identifies with, as well as two, a gender outside of what the individual identifies with. It's a same-sex, quote, same-sex attraction, if you will, as well as another sex attraction, not necessarily female and male, because we're really trying to break away from this binary because, and that segues perfectly into what the T stands for. The T is transgender. And this is an umbrella term for anyone who does not identify with the biological sex that they were assigned at birth. And that might fall outside of this binary, this male-female binary. And it might even go directly against the binary. So someone can be male to female transgender, female to male transgender, or any other gender which does not follow the binary. So whatever that looks like for the individual, this is different than cisgender, of course, which is someone whose gender identity is in alignment with the sex they were assigned at birth. And then we move on to Q, and the Q stands for two different terms, queer and questioning. Formerly, the word queer was a derogatory slur and not necessarily an identity. But recently, the queer community is taking it back and reclaiming it as an identity because it is an umbrella term. And it just means the individual is somewhere on the spectrum of LGBTQIA, but is still maybe questioning, which is why questioning is also associated with it, which is just someone who is unsure of one's sexual orientation and or gender identity, but hasn't felt comfortable with or is unwilling or unable to self-categorize with traditional labels such as gay, straight, male, female, etc. And then you have I for intersex. And an intersex individual has some degree of ambiguity in regard to their primary sex characteristics. So either physically or physiologically, hormonally. So intersex is another umbrella term in that there isn't one way to be intersex. And not all intersex folks are transgender, which is a common misnomer as well. The A is for asexual, and this is someone who doesn't feel sexual attraction for anyone, though they may feel romantic attraction. And of course, the plus at the end is everyone else. You have two-spirit, which is a Native American term for a gender variant outside of the binary. You have pansexual, genderqueer, gender fluid, demisexual, and a host of other identities and orientations. And the point being, we don't get to tell someone that their identity is invalid just because we don't understand it or know about it or identify with it easily. And as well, because we live in such a heteronormative, cisgender, binary world, which labels everyone and puts them into these boxes of gender and sexual orientation, we want to move away from that. And if we can go to the next slide, Megan.
Yes.
There are a lot of myths about LGBTQ plus folks as well. There's a lot of common stereotypes about rural communities that stem from these boxes that we want to put gender in, that we want to put sex in. And so I want us to take a look at these and then break them down even further to show what they might look like in rural areas. So you have this, first I do want to read this quote by Silas House. He's an LGBTQ Appalachian author. And he says, everything is amplified for people who are different in a small town where people try so hard to be the same. So if you're different, you stand out more. And this first one kind of goes along with that. You have LGBTQ plus people are sexually deviant. This is assumed because the numbers for LGBTQ plus fall out of the statistical norm. So statistically, there are more straight people than there are LGBTQ plus people. And that is especially true in small towns where your population is less dense, making it statistically more likely to be a majority of straight folks. This is also because queer people aren't as free to come out in small towns for fear of backlash, which they may not be free to come out anywhere, not just small towns. So when you have those fewer people doing something that society seems as unacceptable, or at the very least not normal, they get labeled as deviant. Then we have LGBTQ plus people are pedophiles. This one is especially stereotyped for gay men. This one comes from a religious psychologist who, despite being debunked hundreds of times, was still relied on for a lot of his false work, claiming that homosexual men were a danger to children and that same-sex couples were a danger to their own children. Statistically, we know it's not true, as the majority of child molestation cases cite the perpetrator as a heterosexual man molesting girls under the age of 18. And we know that most sexual abuse occurs within the family. And so the biggest reason this myth is perpetrated is to keep queer folks in the closet, and especially out of the classroom. That's a big one, especially in small towns, for fear that, we will teach children about being gay. And in rural areas, this is much the same, and if not worse. The only difference is in bigger cities, a gay coach or lesbian teacher or whatever doesn't run the same risk of being outed because of the denser population. So because rural communities are so much smaller, being outed is a higher risk. I used to work at a little bar in my hometown, and the owners were a gay couple that had been together for decades. And one of them had been a coach at the high school, and when some of the teachers and principals found out that he was gay, they politely asked that he resign. They didn't fire him. They didn't want to resort to firing him because that would have looked bad as well, but he was made to resign. So all three of these next ones, gay men stereotyped as promiscuous, lesbian stereotyped as asexual, and LGBTQ or queer relationships being inherently abusive and involve strange sexual practices. These still kind of stem from that place of deviance where if your sex life falls outside of what the majority sees as normal, you must be an abnormality. A big issue with this thought is that anti-LGBTQ plus folks that think that being queer is just about sex. They fail to acknowledge that, we queer folk do things just like everybody else. We go to the grocery store. We do miles and piles of laundry. We plant gardens and raise babies and go to work every day. And it's a deep emotional connection with ourselves and with our community and with our partners. And it's not just about sex. The notion that men can't be raped stems from thinking that men should be strong and able to defend themselves. The issue with this is the obvious gender norms and gender roles that society forces on people, on men especially. Things in small rural towns, notions like this especially, are just exacerbated because many of them have the idea of the strong country sitting on a tractor packing hay into bales or whatever you do with hay. Stereotype. It's just that. It's just a stereotype of a strong man, and this contradicts with their other stereotype of gay men who they see as effeminate or weak. So obviously men can be raped, and also their bodies biologically react in ways that are beyond their control. And so this is a horrible stereotype and stops a lot of men from seeking the help that they need. And then you have that a woman can't be raped by another woman, which has the same negative ideas no matter where you are. And I'll say that growing up in a rural area, I do acknowledge that my experience is not every rural person's experience. Gay men were more of a target of prejudice than lesbian women. And oftentimes these LGBTQ plus people in my community, they were teachers, they were principals, they were professors at the college, they were business owners, and people knew that they were gay or lesbian or bi or whatever. But it seemed as if you were successful at what you did, your job, the majority of folks left you alone. They might have gossiped about you behind closed doors, but all in all, if you were quiet and didn't cause issues in the town or demand change or equality, you were tolerated, maybe even accepted. Um, and it was always an odd dichotomy of hearing at church that gay people are going to hell versus having a gay principal who everyone knew was gay and be one of the most esteemed people in town. So a woman can't be raped by another woman kind of goes along with this next one, is that lesbians can be converted. And so it's interesting because it kind of falls along the same lines that we hear of gay people just haven't found the right person of the opposite sex. Gay people can be cured, which we know all these things is untrue. And I think this one is heightened in rural communities because so much of the religious aspect goes into it. You can pray the gay away or be admitted into conversion therapy, which might cure you with some religious teachings and healings, because rural communities are also so often faith-based and so immersed in their religion and their fundamentalism. They think that LGBTQ plus folks just need to be cured of their proclivities, that it's not just who they are. And then lastly, we have people are gay because of bad experiences with the opposite, in quotes, sex. I think this falls right in the previous one of people are gay because of the lack of good experiences with the opposite sex. And note the opposite is in quotation marks because there is no opposite. It's all on a spectrum. And all these myths can lead to discrimination for queer folks in rural communities, and it leaves them at a higher risk for crimes and other prejudiced violence.
Absolutely. Thank you. Yeah, so let's look more at what LGBTQ plus life looks like in rural settings. Let's look at some of the realities. As I mentioned earlier, there is a common misconception that LGBTQ plus folks don't choose to live in rural America. But the truth is that many do. There are many benefits and appeals to living in rural settings. More and more people, LGBTQ plus or not, are drawn to rural America for many reasons, such as having that sense of a tight-knit, a close community, feeling like everybody knows everybody in town. Rural America offers a connection to land oftentimes for folks. It can offer a slower pace, less noise, less air pollution. These can all be appeals for any one of us. And national surveys show that between 3% and 5% of the rural population identifies as LGBT. There's additional research that shows that roughly 10% of youth identify as LGBT, with rural youth just as likely as urban youth to identify as LGBT. And about 2.9 million and 3.8 million LGBT people, or 15 to 20% of the total US LGBT population, live in rural areas around the country. So that's really a high number. This graph was created by the Movement Advancement Project. You'll hear me reference them a lot throughout the rest of this webinar. And this graph uses both census data and data from a Williams Institute study, which shows that rural states actually have higher rates of same-sex couples raising children than other states do. So many families value the things that rural life can offer, and that goes for families with same-sex couples as well. Now, there are unique challenges to rural life. There's, limited healthcare providers, fewer options for any type of service, really. And there's increased visibility in rural towns that can make it harder for folks to maintain a sense of privacy and anonymity. There's limited employment opportunities. And I think most notably, the social and the political landscape of rural areas can make LGBT people more vulnerable to discrimination. Rural states, and especially southern rural states, are less likely to have legal protections in place for discrimination based on one's gender identity and sexual orientation, and are even more likely to have discriminatory laws in place. So some of these challenges include increased visibility, like I mentioned a moment ago. There's fewer neighbors, lower population, everyone knows everyone. which, like Chloe said, if anyone is different, quote unquote, they're really going to stand out. And this can be a great thing if the community is accepting and supportive, or it can be really harmful for someone who is not ready to be out in all areas of their life, or for someone who lives in an area where some neighbors or circles will reject them for their identity. In rural areas, there can also be what the Movement Advancement Project calls a ripple effect. And that's when rejection from one area of a person's life will lead to rejection in others. So this goes into that previous point about increased visibility. So if a person is rejected by their church or their faith community for their gender identity or sexual orientation, then in a rural setting, it's very likely that they could face rejection at work or at school or from family members, because each of these sub-communities are so interconnected and overlapping in a rural setting. Because your church youth leader might also be your basketball coach, or a fellow church member might also be your boss. There are also fewer service options in rural areas that can lead to barriers for LGBTQ plus folks. There may be one health clinic in the community, and if that health clinic is not a safe space for, say, a trans woman, then what are her choices? Does she have to leave the community and drive miles and miles to receive basic medical care? And just as there are fewer service options in rural areas, there are also fewer agencies that could offer support when someone is struggling with either coming out or when they're facing discrimination. There can be fewer resources available to them in a rural setting. Although rural communities can also have a strong sense of investment in their residents and be very innovative and resourceful with what they have. Which can result in very tight and strong knit support systems as well. So lower in quantity doesn't always mean lower in quality. Sometimes it means higher in quality. And sometimes these rural realities can actually be beneficial. I've talked mostly about the ways in which they can be harmful, but let's flip that narrative together for a moment and think about ways these realities could actually be a benefit to LGBTQ plus folks as well. So if you will participate with this, go ahead and type in the chat box. What are some ways that you think these rural realities listed on the left of your screen, what are some ways that these could actually be beneficial to LGBTQ folks living in rural settings? Give everybody a moment to type in their answers there. Barbara says fewer structural supports motivate people to educate and create new ones. Absolutely. It's that innovation. Chloe says, yeah, knowing by word of mouth where queer friendly places are, definitely. Any other ideas? Sense of community with other queer folks is stronger, absolutely, because you have to band together. Yeah, definitely. And I think it's just important for us to think about some of the benefits and the way that rural realities can really work in favor of LGBTQ folks too, so we don't get bogged down by the stereotype that it's always a really unhealthy or unsafe place, even though that can be the reality, and we're going to talk more about that. A couple other answers here. Great. Social media brings a greater visibility to rural areas, definitely. That virtual connection can be really important in rural spaces. Religious presence could be a benefit because some communities have churches that are accepting of the LGBTQ plus community. And at smaller congregations, people do not get forgotten or left out. Oh, absolutely. That's such a good point. definitely. And something that we do not expect or think of, but that it's true for many churches more and more. Great. Okay, thank you all so much for those answers. All right. Now we're going to move on to talking about some specific laws and policies that affect LGBTQ plus folks in rural communities. This will not be an exhaustive list. I'm not an attorney, and I don't have the expertise to cover all of the laws and policies that are relevant here, but we're going to give kind of a brief overview. So this image comes from the Movement Advancement Project. They had a 2019 report on LGBTQ life in rural America. That's what this image comes from. And you can see that rural states generally offer fewer protections for LGBT residents. And the negative overall tally, which Tennessee has been designated, that denotes that there are not only a lack of protections for LGBTQ folks in Tennessee, but there are actually laws and policies that are intentionally anti-LGBT. So we're going to look more at some of those laws and policies specifically. Well, when I created these slides a month ago, I planned to talk about HB 600 in Tennessee, which is a state law that prohibits cities and municipalities from passing protections against discrimination for non-governmental employees. But we know as of June 15th, just last week, the Supreme Court decided that no employer in any state has the right to discriminate against an employee because of their sexual orientation or gender identity. So woohoo for that. The ruling expanded the meaning of Title VII to cover sexual orientation and gender identity. And that makes HB 600 in Tennessee an unconstitutional law. Now, of course, we do expect that there will be some legal challenges to this recent Supreme Court ruling. We don't fully know yet what the implications are going to be, but what an incredible win for LGBTQ equality. So HB 600 is also known as the Equal Access to Interstate Commerce Act, and I still want to explain how that worked and how that was in place. So many rural areas in the South especially have these religious exemption laws or so-called pro-business laws, which is the case with HB 600, and those allow businesses or non-governmental service providers to discriminate based on gender and sexual orientation, and it's done in the name of religious freedom. So HB 600 or the Interstate Commerce Act is one of those such laws in Tennessee, and it prohibited cities and municipalities from passing protections against discrimination for non-governmental employees. Nashville, Knoxville, Knox City, Memphis, and Chattanooga those were the only cities in Tennessee that do have protection laws on the books for their city employees on the basis of sexual orientation or gender identity. But no rural areas in Tennessee had these protections for state employees or otherwise. And all of Tennessee, rural and urban, was prohibited from passing laws to protect non-governmental employees from discrimination. So, yeah. There's also, like I said, these religious exemption laws. Rural states are, as a whole, more likely to have these dangerous religious exemption laws, which can further jeopardize transgender people's access to medical care or other basic services. Several years ago, we all heard about the bakery shop who refused to bake a wedding cake for a same-sex couple, right? And we know that that's happened more than that one instance, but that was something big in the news at the time. And it was done on the grounds that it would be against these bakery owners' religion. And these laws can extend far beyond, bakeries and the wedding-related industry, and are frequently found in vital areas such as healthcare, child welfare, social services. Religious exemption laws sometimes even often do apply to medical professionals, as they do in the state of Tennessee, which allows doctors to refuse to treat transgender people or offer hormone therapy. And the Movement Advancement Project has found that 59% of rural states have such laws compared to 32% of urban states. So there's some difference there between rural and urban areas. The Don't Say Gay law in schools is it's a policy which restricts teachers and staff from even talking about LGBTQ issues and people. Tennessee does not have a Don't Say Gay policy, but there are 5 states that do, and those states are Oklahoma, Texas, Louisiana, Mississippi, and Alabama. And all of those states, except for Texas, would be considered rural states. So it's an issue that we see more often in rural areas. And then conversion therapy, sometimes called reparative therapy. Chloe mentioned this earlier. It's a practice, an extremely dangerous and harmful practice, the intent of which is to change someone's sexual orientation or gender identity. And generally it's conducted on youth. Sometimes it is practiced by licensed healthcare professionals, although most of the medical community now recognizes the danger of it. And sometimes, maybe more often now, it's practiced by religious leaders or counselors. If you don't know much about conversion therapy, I would strongly recommend that you seek out more information on it. You can find good information from Human Rights Campaign. The Trevor Project has some great info on that. I am citing a study from the Williams Institute, so you can find that study on my references slide at the end of this presentation. And I won't go into too much detail here, but I will just say that the harm and danger of conversion therapy is very real, and because there has been much more awareness on the practice in recent decades, many states have banned healthcare professionals from practicing conversion therapy. But 29 states, including Tennessee, still allow conversion therapy. And even where conversion therapy bans do exist in the US, they do not prohibit the practice among religious institutions. So this is where those religious exemption laws can be really dangerous again. Most of those 29 states that do not have bans on the practice are considered rural. So it's an issue in rural areas for sure, and conversion therapy is especially popular in religious settings, like Chloe said, which again makes it more often seen in rural areas where community members have especially strong attachments to religious institutions and increased pressure to abide by a faith community's set of rules and expectations. And then ID changes, being able to change one's gender marker on their driver's license is an important right that many transgender folks are denied because of the laws where they live. In Tennessee, trans folks are not allowed to change their gender on their ID unless they have proof of surgery or a court order. And there is also a law in Tennessee that doesn't allow trans folk to amend their birth certificate. So there are many trans folks in Tennessee who are unable to change the gender listed on their driver's license. And this is a problem that results in transgender folks being denied services and having their credibility questioned. When they show up and have to present their driver's license in any sort of setting, they can automatically be questioned about who they are. And it can result in increased hostility and discrimination. And then let's talk about some transgender healthcare discrimination. Accessing healthcare coverage is a very real barrier that many transgender folks face. There are some states that have bans on transgender exclusion by private health insurance providers. So those would be helpful laws that prevent insurance providers from denying transgender patients coverage for a transgender-related healthcare benefit. But there are 31 states that do not have that protective law in place, and most of those are rural states. So in those places, transgender patients are at risk of facing discrimination from private insurance providers. And then transgender-related healthcare coverage varies greatly when we're talking about Medicaid. Each state decides if their Medicaid policy covers costs related to gender transition. And a 2019 report from the Movement Advancement Project found that for rural transgender adults who had insurance and sought coverage for transition-related surgery, 69% were denied coverage. Almost 70% were denied coverage for those transition-related surgeries. We also know that just a couple of weeks ago, to complicate this even more, the Trump administration amended the Affordable Care Act and removed provisions that explicitly prohibited healthcare providers from denying services based on a patient's sexual orientation or gender identity. Now, according to the National Center for Transgender Equality, this action sends a clear message to healthcare providers that they can deny care to LGBTQ people when many of them were already. There are some states that still do provide explicit healthcare protections for LGBTQ folks. We're thankful for that, but it's really too soon for us to see, what the full implications of this action are going to be. As we've talked about, there are already these religious exemption laws that can allow providers to deny care to LGBTQ folks. So this move by the Trump administration really just places trans folk, especially in an even more vulnerable position. Okay, so let's take all of this that we've talked about so far and sort of bring it all into a domestic and sexual violence lens. There's some case law analyzed by the Movement Advancement Project that suggests that LGBT parents in rural communities are at a disadvantage in the legal system, given that LGBT people who live in rural communities may be seen as contradicting small town values and could therefore be seen as unfit parents. So let's look at this example from the Movement Advancement Project. There was a lesbian mother who had a custody case in Union, Missouri, a town of 5,500 people, so a small town. Her ex-husband learned after their separation that she was gay and sued for full custody of their children. The State Court of Appeals sided with the husband, writing, "Homosexuality is not openly accepted or widespread. We wish to protect the children from peer pressure, teasing, and possible ostracizing they may encounter as a result of the alternative lifestyle the mother has chosen." That just makes my blood boil. I mean, this father was given full custody because the kids may face teasing, essentially. Think about the implications of that for an LGBT domestic violence victim. The threat of a child custody war is almost always a present barrier for victims who co-parent with their abuser. So imagine if this woman in Missouri was being abused by her husband. We don't know that that was present here, but if it was, outing her and suing her for custody of the children would most certainly have been an abuse tactic that he would have used against her. And then we want to consider the fact that overlapping marginalization and vulnerabilities equate to amplified barriers for survivors of domestic and sexual violence. According to the Human Rights Campaign, as a community, LGBTQ people face higher rates of poverty and homelessness. There's homelessness data from the National Coalition for the Homeless that shows that up to 40% of homeless youth identify as LGBTQ. And isolation can be a real issue for folks in rural areas, and then it's also an issue for LGBTQ folks, and can also be a barrier and issue for domestic and sexual violence survivors. So when you have a person who embodies, all three of those identities, then isolation is going to be a very real present issue and barrier. Then there's often a fear of police, especially among trans individuals, as well as discomfort receiving medical attention. And again, we often see LGBT folks face unfair treatment by the judicial system. So these are all the overlapping vulnerabilities we have to address in order to really promote equality and safety for LGBTQ plus survivors. So now let's talk about some of the best practices and recommendations that we can implement in our domestic and sexual violence work. What does creating a safe space for LGBTQ plus folks look like? Um, we want to, look at our intake paperwork, our client paperwork, marketing materials, our websites, the posters in our office, the bathroom markers. That's a big one we often overlook. And ask ourselves, could a person of any gender and any sexual orientation find themselves in the images and the language that we use? Could anyone walk through our doors and know that this is a safe space for them to be? I think identifying our agencies as a safe space for LGBTQ plus folks goes so far beyond having a flag hanging in our window or placing a flag on a brochure. I think we all really have an opportunity with every social media message and every radio ad or poster, even with our intake paperwork, to tell folks that they will be seen and validated and safe in our agencies. You may also want to consider offering gender integrated shelters. We want to think about how segregated services, segregated by gender, will affect transgender or non-binary survivors. Gender non-conforming or non-binary folks may feel an additional, and often do feel an additional burden or stress if they are asked to choose between binary options of male or female, neither of which corresponds with the gender that they identify with. So offering LGBTQ plus specific support groups is a wonderful way to provide more individualized care, and offering these in a virtual format can be especially helpful for any LGBTQ plus folks in your community who are not out and would want to remain anonymous while still receiving much needed support and services. We also want to, understand our unique community, know where the safe resources and referrals are. We never want to refer an LGBTQ plus survivor to, say, a therapist who we haven't vetted before to know if they're really going to be a safe space for that individual. Staff training is so important. We want to ensure that all staff from the bottom to the top and back down are all trained, and make an effort to hire LGBTQ plus folks at your agency. Centering and elevating marginalized voices really starts with our hiring practices. I think that says a lot. And then we want to consider outreach and partnerships. So we want to partner with LGBTQ plus groups and community organizations in our areas. And if you are in an especially rural community where there is no such group, look a little outside of your community and into the next urban area. And I guarantee that just because your community doesn't have, say, an LGBTQ plus center or organization, that does not mean that your community doesn't have LGBTQ plus folks living there. They are just likely traveling outside of the community to participate in the Pride events elsewhere. So look outside of your community as well. And then Chloe, I'm gonna let you take the rest of this slide.
All right. And so many of those same practices that Megan just said, those thoughts go into DV shelters, or dual DVSA shelters. It's a commitment to thoughtfulness and continued learning. So creating a safe environment for LGBTQ victims, you do this by making sure that there is adequate representation, whether that's in your flyers, your pamphlets, your offices, your intake rooms, your advocacy, all of it. Having appropriate and queer-friendly information and referrals, like Megan said, on hand is a necessity to ensuring inclusion. That, like she said about the support groups, make sure that you're referring them to the right support groups and make sure that those groups are inclusive, especially the virtual support groups. That was always a great idea. In my hometown, we had a virtual online sexual assault support group for LGBTQ folks. And so in saying that, just remember not to assume that every victim you come into contact with is heterosexual or is cisgender. Ditch the notion of assumption altogether. If you don't know or aren't sure, a simple way to do this, to find out without offending your victim, is to ask about their pronouns. And when you're doing your intake, make sure that there's a place for you to ask about their orientation. because it's, for most people in the queer community, it's not just an orientation, it is part of their identity. So it's also important that you don't pressure the survivor to file a police report or follow up on legal action. We don't want to do this with any survivor, of course, but especially not LGBTQ plus survivors of domestic or sexual violence, for many reasons, many of which Megan talked about just a few moments ago, because queer victims can have a tremendously more difficult time in the court system. For trans folks, this can bring up issues of documentation and IDs that might not align with the gender identity, with the gender they identify with. And lawyers, even judges, especially in rural areas, are not above using that against them, like we just saw in that case study. As well, respect an LGBTQ plus survivor's individuality, especially in reference to the way that they may dress or appear. Not every trans person is passing, quote unquote passing, which means that not every trans person appears or can be perceived as the gender identity that they do identify with. And I know a lot of shelters, SA organizations, and the like have bags that they prepare ahead of time, and especially for sexual assault. And these are usually gendered. You have bags for women and bags for men. So it's a good idea to have some on hand that are not gendered, that are unisex. Because the LGBTQ plus victims have different sets of fears about being in co-ed shelters or even a women's shelter or a specific gender shelter or whatever, you don't minimize their fears and concerns regarding that cohabitation, and being inclusive from the get-go by asking about their pronouns, by providing them with a unisex bag, are automatically letting that victim know that you are inclusive, that that organization is inclusive. So, and as well, don't minimize their fears and concerns regarding the court system, mental health treatment, medical treatment, all of those things, because with things like conversion therapy, reparative, quote, reparative rape, body shaming, rejection of identity, all these things, they have some different fears that heterosexual and cisgender folks might not have. So always keep that in mind. And lastly, when you are advocating, remember that you are advocating for all victims of domestic and sexual violence. So when you post something on social media with pronouns in it that reference the abuser as a he, you are turning away possibly lesbian or bisexual victims whose abuser is a she. Same with your flyers and outreach materials. Remember that any message that you send out to the public should be one of inclusion, and inclusion is for everyone.
Absolutely, that's great stuff. Okay, so let's look at some best practices and recommendations for sexual assault response teams. When we look at these special considerations for all the members in a SART, we want to think about the importance of that initial contact made between the victim of assault and the service provider. Because when a person has become accustomed to living in a world in which they often face discrimination or hate, that initial first impression a service provider makes is going to be a really, really important piece. So it's important for law enforcement, especially, to receive education on things such as pronoun usage. You know, if law enforcement can partner with their local LGBTQ plus community organization, and hire a representative even, or a victim advocate or liaison, that can be extremely helpful. Also, training on trauma-informed questioning is important for all responders. Remember, an LGBTQ plus survivor could be fearing blame or could be feeling self-blame. So eliminating any victim blaming language is very important, and something that a lot of those first responders don't think about or haven't been educated on. So things like documentation is important. We want to avoid details about attire or dress. That those things are never important, but can sometimes be a question in a law enforcement officer's mind. We never want to use words like intercourse or sex when a victim is reporting that they were raped. Some other terms to avoid would be confess, admits, that victim blaming language. And if we're helping, say, a trans survivor, we never want to ask questions that begin with phrases like when you used to be male or when you used to be female. And that's only if for some reason it would really be relevant to the situation at hand. It's unlikely that it would be, but we never want to ask questions related to anatomy, gender, or sexual orientation unless absolutely necessary and relevant. And then in those cases when we have to, we always want to explain fully and apologetically on the front end why it is that we have to ask those questions. I also want to plug End Violence Against Women International's training tool called Gender Bias in Sexual Assault Response and Investigation. It's a really great tool for sexual assault response teams to learn about implicit biases and how they can affect our work. And as Eve Alwe teaches, implicit biases are not inherently bad things. They are a normal part of how our human brains work. But our brains are conditioned to translate our implicit biases into sometimes discriminatory behavior because of the social hierarchical structures that we live in. So learning about how that works can really make a big difference for responders, especially law enforcement and the courts, where trans survivors, like Chloe was saying, especially are often seen as not credible. Their gender identity or sexual orientation is used against them. So equipping partner agencies with the tools that they need for culturally sensitive and trauma-informed care, and that's really important. And then also understanding how each professional's role works together for the benefit of the survivor is an important piece. If everybody understands and is in agreement on the front end with how we're working together, then the process is going to go more smoothly for the survivor. And we always want to encourage all of these partners to center survivor autonomy every step of the way. And then case review can be an important practice for sexual assault response teams. Case review provides an opportunity for teams to look back on how cases were handled, how they moved through the system. The process provides an opportunity to look at what might have gone wrong in a case, as well as what went right. And my point in highlighting that here is to say that when the victim in a case is LGBTQ+, it really is important that there be someone on the case review team who can be a voice and an ally to look at the case with an LGBTQ+ lens. Because a room full of people, even if they have the greatest intentions, if there's no one there who has any familiarity with LGBTQ+ issues or experiences, there will inevitably be a blind spot there.
Yes, much, all of that. Yes, all of that. You have to have everyone on your SART team needs to be on the same page. So that was really awesome. And you also, when you're working with medical professionals, and you want medical professionals on your SART team, you want to be on your county's health council or your city's health council if you can. And within medical settings, so one of the first things you want to do, as with any other setting, remember that as soon as a queer person enters the waiting room, think about the kinds of magazines that are there. None of them probably have openly queer folks on them. And if they do, they aren't always portrayed positively. And especially in rural areas, they're not going to have the latest edition of, LGBTQ+ Weekly sitting in the waiting room. So it's little things like that from the beginning that can make a queer person uncomfortable or feel unwelcome. Just like your shelters and offices, medical settings should have inclusive posters that make queer folks feel a sense of belonging and someone that they can identify with. Non-discrimination policies that include sexual and gender minorities can be posted in waiting rooms and exam rooms, and they should be posted in those places. Unisex bathrooms also, they ensure that transgender or non-binary patients do not have to make a choice in the waiting room that maybe they weren't prepared to make that day, and they certainly shouldn't have to make any day. Your medical intake packets are also a good opportunity to make sure patients of all sexual and gender identities feel included and welcome. Intake forms, for example, will ideally have questions that allow options besides male and female for sex. For example, M/F/transgender, or MTF/transgender, or FTM/intersex/other. Or even they can just leave it open-ended for gender and just have a blank for the patient to fill in. The form should also allow for different sexual orientations, sexual behaviors, and relationship status with gender-neutral language, not having husband or wife, having just spouse, significant other. As well, always state that the information is asked of all patients and is used to ensure that comprehensive care is given. Explain that patients can skip questions if they wish, if they can be skipped. They can't always be skipped. Pronoun labels when they walk in the door are also a really good idea. I went to a facility in Memphis recently that as soon as I got there, I signed in and then signed my first name and my pronouns onto this little sticker label that the person at the desk then put on my file to be taken back. And can you imagine the relief of a transgender person in knowing that they're not going to have to tell 5 different people that day in that hospital or that clinic or that facility what their pronouns are, what their name is, and why it might be different than the name on their license or even their insurance. And speaking of insurance, since some patients have concerns about the accessibility of such information to insurers, employers, or others, it is helpful to state explicitly that all information is confidential and will not be released without consent. As well, LGBTQ plus folks are at a higher risk for smoking, diabetes, drug addiction or dependency, alcoholism, and other diseases. So remind your medical professionals to screen according to their current guidelines, but also be mindful that there are significant increases in the risk for queer folks. Lesbian and bisexual women are at a higher risk for breast and cervical cancer, while gay and bisexual men are at a higher risk for anal cancer and mental health disabilities. So providers need to be aware of these issues. And as recently as April, a university, or as recently as February, a university in rural East Tennessee asked me to come speak to their medical school students about queer health because they weren't getting it in their classrooms. So trust me, everyone needs to be taught about inclusion. And the same goes for your coordinated community responses. Everyone needs to be taught about inclusion, everyone. Get everyone, as many folks as you can, get them to understand that just being accepting doesn't automatically mean that they have to have a huge rainbow flag on the porch. And support and acceptance doesn't mean folks who disagree will suddenly stop supporting them as an organization. Folks disagree about a lot of things. Colors of shoes, going with certain colored belts, thoughts on drinking and gambling and smoking cigarettes. They will still likely be friendly to you, even if your organization is friendly to LGBTQ plus people. So taking a stand is just saying that we are not discriminating and we are committed to not discriminating instead of remaining silent. Because as we know, silence is more often than not compliance, and especially on issues of human rights and human justice. Very importantly, and I think Megan touched on this already, of course, is word of mouth in small towns. The town I'm from is super, super small. I graduated high school with only 48 students in my whole high school. And I know how small town gossip, for lack of a better word, goes, but it can be used for your and their advantage. Like Megan said earlier, there are pros to it. And word of mouth in a small town is everything. And word of mouth in the LGBTQ plus community in a small town is also very powerful. Once a business or service provider is known to be inclusive and welcoming, queer folks will talk amongst each other, especially in rural queer communities. So, and one of the last things, start changing your language. Start changing the language that you use. And if you're using it, they might too. And if they're using it, others will notice. The right people will notice if you're saying things like same-sex marriage versus gay marriage, or if you're making a point to be inclusive and not just saying ladies and gentlemen versus honored guests, or just y'all. I love that one. I use y'all all the time because it is inclusive and it's super Southern and I love it. Saying things like people, folks, citizens, individuals instead of men and women. And instead of saying the gay community, saying the queer community. And any comparison where the word normal would be used, start phasing that out as soon as you can. And language is so important because it is so powerful. It's how we communicate and it's how others communicate with us, and they pick up on those things. And if they can, if your community team can, encourage them to start making small changes to their paperwork and their policies. When you have folks that are hesitant, encourage them that this will also cover their own backs. Point out the liabilities in not having these inclusive policies. And for resources on how to create these inclusive policies, Megan has put together a phenomenal list here. We have the Tennessee Equality Project. They have Counseling Unconditionally. This is a site where you can go in and enter I think it's a zip code maybe, or maybe even a city. It may function with a lot of different things, but you can enter this in and it will pop up mental health counselors and therapists that have committed to being queer friendly. So if you have victims and survivors that are in need of mental health care, you can go into that and immediately know who is going to be friendly in your area. There's a flyer from the Movement Advancement Project that you can personalize. There's the End Violence Against Women International training tools that Megan mentioned earlier, and I have used those and they are absolutely phenomenal. The DOJ guidance, Identifying and Preventing Gender Bias in Law Enforcement Response to Sexual Assault and Domestic Violence. The Gay and Lesbian Medical Association, if you need more information on that. Intersex Society, Human Rights Campaign, Appalachian Outreach. All of these places are fantastic and can also lead you to even more places. And so I think that that is all that I have to say. Megan, do you have anything else before we close out and open the floor for questions?
I will just say that the End Violence Against Women International training tool, that training tool has been developed for trainers like us in the field to reuse. So they have the PowerPoint slides created and the talking points and sort of a rough script, and I think like some handout materials too. So it's everything that you could need to go provide that training yourself. So I think that is just incredibly helpful, especially for like domestic and sexual violence agencies who want to provide training to, say, law enforcement officers or SART team members, but don't necessarily have like a whole lot of time to put together training materials themselves. So I will say that I think that's a really great tool for that reason. But I mean, amazing stuff. So many great recommendations, Chloe. That was awesome. Here's our contact information. Both of our email addresses listed there. That's the main line to the Tennessee Coalition office where you can reach both of us. And yeah, we really appreciate all of you being here today. And we're available for questions. It's a little bit after 11 o'clock now. I'm sorry for that. I think we were supposed to stay under an hour. But I think we still have most of you here. So if anyone has any questions, please go ahead and type them in. I'm going to open up my question box here and see if anybody has anything they want to talk about. Will the slides be sent to us? Yes, absolutely. Kendra, our training coordinator, is going to be sending out those slides along with your training certification for attending the webinar. Absolutely. And if any of you have any other like resources that you are really curious about, if you want additional information, you can email us, or if you want to shout it out now, we can be sure to like send resources or additional materials out to the entire group. So yeah, we're definitely available to kind of further this conversation and be a resource to you. Any other questions? All right, I don't see anything else coming in. Oh no, here's one. Are there resources that you know of offhand that would assist in training clergy? Great question. And I am going to recommend, oh, Chloe, do you remember what that agency's called? It's Safe something. Safe, is it Safe Havens?
I do not remember.
So I'm pretty sure it's Safe Havens Interfaith Partnership. And I'm Googling it really quickly to make sure I have that right. Yes, Safe Havens Interfaith Partnership Against Domestic Violence. They are a really, really fantastic organization. And that is the one, I'm sorry if that's one you've already heard of, but that's the one that I would definitely recommend. If you have already heard of them and you're looking for additional options, then I can definitely do some research for you. But that's the only one I know just off the top of my head. Thank you for that question. Okay, Oriana is saying yes, additional recommendations would be helpful. So I will absolutely look into that for you and let you know what else I can find. Do you know of any others, Chloe?
I do know of one other, and it's in association with the Universalist Unitarian Universalist Church. They have a lot of really fantastic trainings, especially on comprehensive sex ed and inclusive sex ed, but they also have just a plethora of other related inclusive training. So I can send that information to you, Megan, to pass on.
Awesome.
Yes, so that's it.
Okay, thank you. Thank you for such a good question. All right, I don't see any questions. Any other questions coming in? So thank you all again so much for being here. Thank you for this work that you do. We really appreciate you all, and please stay in touch. Everyone have a great rest of your day.
Thank you guys. Y'all have a great day.